Many times I begin my talks with trying to show people just how important it is for people to see how things are connected, to see that when you're talking about health, let's say you have a cardiac condition, a heart condition. When you're talking about a heart condition, the solution to that problem is not just a heart medication. There are so many other things that are involved in what goes on in the heart and what affects your physical heart, and that includes your spiritual life, your mental life, your social life, your financial life, your physical environment. So many things come together to affect your cardiovascular system. And what we want to do, as always, is to help to make all those different factors, bring those different factors to your understanding and make it simple enough so you know instinctively what to do in certain circumstances, and you know how to keep all those bases covered. But then again, when we talk about spirit, soul, and body, we also, within the body aspect, we also have to focus on the different things, like Sherry said, that connect with different parts of our body, and the mouth, for instance. And I'm not going to say too much about this because Dr. Luna is going to explain this, but the mouth, what happens in your teeth and your mouth, surprisingly enough, affects several parts of your body. And so that's why I am so happy again to have Dr. Luna, a man of his caliber, come speak to us about the connection between what happens in your mouth, what happens in your body. And Sherry, I'm just going to ask you to take it away with the bio.
Okay. Dr. Luna is a 1994 graduate of the University of Alabama School of Dentistry. After graduation, he completed a 2-year residency at the Medical University of South Carolina before returning back to Birmingham, where he has served the public's needs since 1997. Dr. Luna has received multiple awards and recognitions during his 12-year career, including being recognized as one of America's top dentists every year since 2003.
Wow.
Recognized as one of the leading health professionals in the world in 2005. He was also voted Best of Birmingham in 2008 and 2009, and he's one of the youngest dentists to ever receive a fellowship award in the Academy of General Dentistry. Dr. Luna presents multiple lectures throughout the year to the public, to dentists, and to physicians on topics ranging from cosmetic dentistry, TMJ, about mercury filling, treatments for snoring, and sleep apnea even. Known for his cosmetic dentistry, Dr. Luna's work has been highlighted in dental laboratory magazines and continuing education courses throughout the country. Dr. Luna is an avid outdoorsman and enjoys almost every activity that you can do outdoors, including hiking, camping, boating, fishing, mountain climbing, and triathlons. His favorite thing to do is travel, and he spends as much time as possible that he can with his 2 daughters. So, Dr. Luna, are you there?
I am here.
Okay.
Can you hear me fine?
Yes, we can. We can. And again, thank you for taking the time to prepare for this and to grace us with your information. But I just want to have a quick question, though. I mean, how did you manage to accomplish all this? I mean, you don't look any older than 18.
Oh, the picture's 10 years old now, so.
Is it really?
No.
Oh, good job.
I think once I got out of school, I kind of got real serious about it and realized that this is the rest of my life, and started noticing there's actually one doctor in residency in particular that opened my eyes to the effects the mouth can have everywhere else, and it was this specific doctor in Charleston that really made me start going on and thinking outside the box and seeing what else we can accomplish.
Wow. Well, you have the floor, and we are listening intently.
Okay. Well, I'm nervous because you built this up so big. So hopefully I can entertain and keep everybody interested here, and I want to thank you for this opportunity and the chance to talk about some of the topics in dentistry that I feel very passionate about. And there's really three things we're going to talk about tonight, and the possible serious effects that these areas have on the rest of the body. And I hope at the end of this will open your mind to think outside the box and for possible treatment modalities that no one would usually consider. We'll keep going from there. One of the first things that always pops up, is kind of a joke around my office, is the saying, "But you're just a dentist." People always ask, "Well, I've got this problem here, but I realize you're just a dentist." So, they want my advice, but they're telling me I may not know the answer. And that's okay. We understand that. And I've always wondered what's happened. You look at every part of the body, and you have a physician specialist for everything from your feet all the way up to your hair. But for whatever reason, we have disassociated the mouth from the rest of the body. And I think you're starting to, as you mentioned earlier, your physician that treats cancer, people are looking at things different now and realizing, okay, for whatever reason we've done this, this is kind of the gateway to the rest of the body as we're going to talk about, and hopefully things will continue to change that way. Mm-hmm. But as I look into the past and wonder why it's happened, all I can come up with is the fact that hundreds of years ago, if you had a problem where you needed a tooth pulled, you could go to the barber. You could get it done. And so that's why I have that picture in there for that reason. And sometimes it's little things like that that dictate the way things are done in the future, just like brushing your teeth twice a day. That was a commercial that came out, I don't remember now, 60 years ago. And it was a toothpaste that says, see your dentist twice a year. And from that reason on, insurance dictated that's how often patients should come to see a dentist, twice a year. So it's always amazing how something so little can dictate the future of a profession.
Wow.
Anyway, there are the three things we want to really talk about today, okay, and affecting the body. It's going to be first periodontal disease. I'm not going to spend a whole lot of time on this unless people have a lot of questions on it. We're also going to talk about TMJ, and then I'm going to finish with amalgam or silver fillings, and these are also called mercury fillings. I've always found that this is where most people want to ask the most questions, and so I've saved this for last so we'll have more time to answer anybody's questions. So let's start off with periodontal disease first. What is it? It is the leading cause of tooth loss in adults. The scary part about periodontal disease is that 70 to 80% of all adults have some form of it. There's different degrees of severity. Basically, it's a bacterial infection that is eating away everything in its path. So this bacteria is eating the tooth, it's eating the gums, it is eating the bone that holds the tooth in the jaw. So what are some of the signs of gum disease? Red or swollen gums. Bleeding gums. So if you brush your teeth or you floss and you see some bleeding, that's not normal. If your tooth is loose, obviously you got some issues. Bad breath. And sometimes pain. Usually it's painless until it gets to a very, very severe state where your hopes of saving a tooth are pretty much none. And so the problem with periodontal disease and why it is so significant is because it tends to have no pain. So sorry for the picture,
Yeah.
but I hope everybody can see my arrow here.
Mm-hmm.
This is basically what happens periodontal disease. It's every day we build plaque on our teeth. This is what we're supposed to brush off. If we don't brush all of it off, we end up, the plaque mineralizes and it becomes tartar or calculus. That's a hard substance that we can see right here on these root surfaces. This is just nothing but bacteria, as I said earlier, that's eating away everything in its path. So if you look across here, this is where the root surface and the tooth itself meet. This is where the gums and the bone used to be on this patient. And all this bacteria is eating away all the gums and bone from there down to there. Okay, as we can see, we've already lost teeth. We have mobility. You can kind of tell this tooth's been pushed out and moved around. So this is obvious for anybody to see.
Are those teeth Are those teeth joined together, the lower incisors? Are they actually joined?
These are here because these teeth are very loose, and this unfortunately is a patient that probably do not want to go on with further treatment recommendations, is doing everything they can to save them. So when this patient came to me, they were splinted together like this, and it was just a hopes of holding them so they wouldn't fall out individually.
Okay.
When they lost their teeth here in the back, all their pressure is now being put on these front teeth, and they're not meant to receive that force. So this person will lose these teeth in the end, obviously.
Hmm.
What might not be quite as obvious, is more what everybody else is walking around with in general, is this. Everybody's got their teeth. The gums are just a little puffy, a little red. Okay, we do have some cavities here, but this is typically what it is, and you're not going to have any pain. And this is why only 40% of the population sees a dentist on a regular basis, and they don't know they have it going on because it doesn't hurt. So how does it relate to the rest of the body? Well, what's interesting is years ago, they were doing research on stroke victims and heart attack victims and everything else, and studying the plaques that were in the arteries associated with these. And what they found was a bacteria in these plaques that's found nowhere else but in the mouth. And that's when everybody started opening their eyes to, okay, what can gum disease be linked to? So when you have gum disease, you have a much higher risk of a stroke. You have a much higher risk of a heart attack. Lung infections, uncontrolled diabetes, and one of the recent things I've been talking about a lot, and the OBGYNs are very interested in, is there's a link between gum disease and premature low birth weight infants. And they don't know why yet, but they're very intrigued on how this correlation is working. And as Dr. Dave already mentioned, there's other things going on related with cancer and everything else.
Can you explain why the ones before the premature low birth weight baby, uncontrolled diabetes, for instance, do they know why?
Some of them they don't. They're doing a lot of studies, even with the strokes and heart attacks. One of the things they've noted is the bacteria that's in the plaques that are in these victims. Basically, every day we have all sorts of bacteria that's in our mouth, and it's the one area of the body where, truthfully, part of the skeletal system, teeth, is exposed to the environment. It's the only area in the body that happens. And we're eating all day, we're taking all these foods, we got bacteria everywhere in the mouth, we brush our teeth, we floss our teeth, we got some gum disease, we bleed, and that bacteria gets into our blood system, and then also, of course, being transported throughout the rest of the body. And so with more research, we'll probably find some other things that it is affecting also. So this is one of the areas we'll continue to see, I think, in the future of dentistry, more issues with periodontal disease or gum disease and how it relates to other things going on in the body. But the research is still going on, and I'm sure it'll take years before we come up with definitive diagnosis for some of the things. So if somebody's ever pre-medicated in the past, this was basically why they did it. If they ever had to have a surgery or had a tooth pulled or anything that could cause bleeding, especially in the mouth, they took a large dose of antibiotics before they came in so that the bacteria that entered the bloodstream wouldn't enter the heart and attach to a leaky or faulty heart valve. And then next thing you know, they came in for a cleaning of teeth, and now they've got a heart infection and have to have open heart surgery or be in ICU on all sorts of IV antibiotics and everything else. My two daughters. So that's from a periodontal standpoint, a gum disease. That was really what I wanted to hit there, just to say that there's a lot of research going on. There is correlations to a lot of illnesses, and it's very important that an individual goes and sees a dentist at least twice a year, since that toothpaste commercial said that, just to make sure you don't have this gum disease. Knowing that 3/4 of the population has it, some form of it, and it's something very simple to take care of. It's hard to imagine that something as simple as a cleaning can help prevent strokes and heart attacks in low birth weight infants. And so the 60% of the population that doesn't see a dentist on a regular basis, and if there's anybody out there now listening to it, I hope this would convince you to go in and get an examination from your dentist. Is there any, before we move on to TMJ, do you want to answer any questions on periodontal disease?
Sherry, do we have any questions coming in?
Not yet, but that's a good reminder. If anybody does have a question that comes up during the presentation, on your blue panel on the side, there's a little question tab. If you open that up, you can type us questions during the webinar that we can either ask during or at the end.
All right, we want to move on?
Yes,
Yes, sir. Let's do it.
So I'm going to move on to TMJ. TMJ is just a broad term for a multitude of symptoms that we're about to go over. But what TMJ is, there's a lot of names for it. One is temporomandibular disorder, myofascial pain disorder, locked jaw, bruxism, clenching of teeth. These are all different names for TMJ. So what are some of the signs and symptoms of TMJ? Worn down teeth. Abfraction lesions. Abfraction lesions are little chipped out areas at the gum line on your tooth. So you might be able to put your finger there and feel these little divots near the gum line. Old theories from dentists used to say that you were brushing your teeth too hard and wearing away the surface. And that's not exactly true. What it is when we clench our teeth together, we can put so much force on our teeth. We can put as an average 160 pounds per square inch on our teeth that we literally bend the tooth. Half the tooth is the root that's in the jawbone. Half the tooth is what we see in the mouth. When we clench our teeth, we actually cause that teeth to flex and bend. And just like a stick, if you were to grab the ends of it and start to bend it, the stick splinters in the middle before it breaks. That's what an abfraction lesion is. You're putting so much force on the tooth, you cause the tooth to bend, and it splinters right in the middle, which happens to be there at the gum line, before it actually breaks. So if you have these little chipped out areas at the gum line, that would be a sign that you are clenching and grinding your teeth. That also leads to sensitive teeth. As the gums and the bone recede around the tooth, the root surface becomes exposed to air, and it's not the same as the enamel surface, so it's a little more sensitive. Jaw tightness or pain. So if somebody tries to chew gum and they notice that their jaws get tired after 5 minutes of chewing, this is a sign of TMJ. Also, is clicking and popping in the joint itself, which happens to be right in front of the ear. So the temporomandibular joint is actually this joint. When you open and you close, you feel right there. It has a disc of cartilage that sits inside there just like your knee. And most TMJ, when we talk about it, is a clenching and grinding and muscular problem. About 10% of all TMJ cases are actually a derangement or a problem in the joint itself, with the disc being displaced or torn, just like you can get a knee injury. Things that people don't realize that go along with this could be stuffy or ringing ears. So we have a lot of people that go to the ENT and then come back to see us because they did not have an ear infection. If you were to stick your finger inside your ear right now and push forward, and then open and close, you will feel your joint right there. So if you have a lot of inflammation in the joint, it's right up against the ear canal, and you get this stuffiness and sometimes ringing in the ears. And it is actually not a true ear problem, but a joint problem itself. Another thing that confuses a lot of people think they have a lot of sinus problems and a lot of sinus infections. The top teeth, all the roots of the top teeth, basically pregnate into the sinuses itself. And as you're putting all this pressure on your teeth and keeping everything inflamed and irritated, the maxillary sinuses also are inflamed. And so people think that they have all these sinus problems when it's an actual problem with the teeth and the clenching and grinding. And I'm going to talk about that more in just a second. The same thing with headaches, and this is one of the areas I love the most, and we'll talk about this for a while, from sinus headaches to tension headaches and even migraine headaches. 40%, hello? Can you hear me?
Yes, we can still hear you.
Okay. 40% of, there's studies out there saying that 40% of all migraine headaches have been related to clenching and grinding habits. So it's promising to think that if somebody's suffering from migraines, there's appliances we can give them that can reduce their migraines by up to 40%. If you know somebody that wakes up in the morning with headaches, I can pretty much guarantee you we can relieve all of their headaches with the appliance that we make that you sleep in.
Could you tell me a little bit more about that?
Sure. There's two reasons why people clench their teeth. One is a bad bite, and to not get too complicated, the mind is basically trying to create and find that perfect bite where all the teeth hit evenly. And so it rubs teeth together, trying to create it, pushes teeth in all the directions. So when your bite is off and unbalanced, you will have a tendency to clench, kind of like chiropractic beliefs. If muscles are out of balance, then you can have more back pain and everything else. The other reason why people clench their teeth is stress. Well, there's an appliance we make that addresses the bad bite. Something it's truly a diagnostic tool meant to be worn 24 hours a day. But most people just wear it at night when they go to bed and do most of their clenching. And on this appliance, we actually create the perfect bite. So your mind, in essence, bites onto this thing. Everything feels balanced. Everything feels even. And you've basically fooled your mind into saying, okay, I got the perfect bite. There's no reason for me to clench my teeth. And so you don't do it in your sleep. And now your muscles are no longer tense. And you wake up headache-free.
Interesting.
Another symptom that a lot of people go to physicians for would be the neck pain. And along with the headaches, the neck pain, there's certain muscles that are actually in the neck that are associated with clenching and chewing. And so if you're doing this all night long, you wake up with the headaches, but you also can wake up easily with neck pain, shoulder pain, upper arm pain. And another area is numbness. So if you have numbness that's radiating into the back of the hands or the fingertips, or a person we just treated last month, all around their mouth and their lips, they were numb. Numbness could be the muscles, again, contracting and being overused and inflamed and pinching on the nerves, and so you can get this numbness. So there's a lot of symptoms where people are going to other physicians and getting treated and being put on a lot of medications for their headaches, for their neck pain, or numbness, or going through CT scans when it could be something as simple as clenching and grinding the teeth. So if you were to look at your own teeth, or if there's any physicians here and they look at a patient's teeth, some of the signs and symptoms here, you can see this area right here. This groove fits perfectly into that point right there. So you can tell if they bite down and slide to the side, that will fit right there. This will fit right into this area. Everybody see that?
Mm-hmm. Yeah.
And then here's an example of an abfraction lesion over here. So we can see this flat area right here on their tooth. They're worn the tooth down here, and they're putting so much pressure on it that it flexes and it starts to chip away right there. Here's another example. These teeth are very, very short. You can see the wear. The tooth is actually wider than it is longer. So they've put so much force on their teeth and been rubbing them together for so long that the tooth is now half of its regular length. Another perfect example. There's no way you can see that point right there doesn't fit exactly into that spot when they're chewing. And we're talking about the hardest surface in the body, which is enamel. So as we're putting, on average, 160 pounds of force in here and rubbing back and forth, we're just wearing the teeth down. And you do it, you don't do it all night long, you'll do it in spurts. And you'll do it during times when you're more stressed out. So if by chance you didn't sleep very well the night before, the following night you don't actually get as restful sleep as you think you do, and you'll really clench your teeth bad that night. Also, drinking, alcohol, just irregular sleep patterns and stuff will create this problem. And if you have if you're a type A personality, have a lot of stress, of course that's the other aspect of it that is a little more difficult to control. It's not only always stress-related or something. Dentists can actually cause part of the problems themselves. If you look here, these are crowns. When this patient came to see me from a previous dentist, they're older type crowns with a metal base, which is this black line. And some of the older porcelains were very abrasive, like sandpaper. So if you don't catch this early, This person's bottom teeth here, you can see, have been completely worn down by rubbing against this abrasive porcelain. And these teeth are half their normal length, and these little dots you see here, 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 and here is actually where the nerve in the tooth used to sit. So, you know, this person could end up going to root canals and having all sorts of problems.
Is it painful at this point?
It is not. It's a slower process, and so the nerve, actually, there's enamel on the outer surface, this white area, and then this orange area is something called dentin. And the nerve, when it sits there, it was throwing out more dentin as it realized it was basically being attacked, the tooth was being traumatized, trying to throw up an extra wall of defense. So the nerve used to sit, say, up here. The nerve is receded all the way down here. So it's trying to avoid further trauma. So when it comes to talking about TMJ, 90% of it is muscular related. So we really talk about that aspect of it. There's two different philosophies that are out there. One is centric relation and a Pankey philosophy, basically based out of Florida. Another is, and it's been around for a very long time, it's kind of the gold standard from the beginning. Neuromuscular dentistry is something that's come into play over the last 40 years and is being basically taught out at LVI and being taught by a lot of the big lecturers in dentistry and stuff now. I've had training in both, and I say that I believe that both of them work with certain cases. So I don't think that either one is completely right. I think they both have their ideas. Centric relation is basically based on the idea of where the bone sits in the joint, and then the teeth have to be balanced from there. Neuromuscular dentistry involves using TENS units and talks about the muscles and where the muscles want the bite to be. The reality is, since I've had training in both, I've been able to treat both ways, and I've had some unbelievable results with patients. Some examples of that, one day we had a young girl sitting in our room, and she was in there for a cosmetic consult. I could tell by looking at her teeth and her jawline and everything else that she clenched her teeth. And so I started asking questions, and I looked at her mom and her sister who happened to be sitting in the room with us, and I could just look at their teeth and could tell instantly that they all were grinding their teeth. And I said, just like you're grinding your teeth, you may have headaches, you may have neck pain, and all of a sudden their eyes just got really big. And I knew I'd hit a chord, and I said, okay, what's going on? And the sister, who wasn't actually there for anything, had been to 5 neurologists here in town with her debilitating headaches. They could not figure out what was going on. They had no more ideas, so they were sending her to a special migraine clinic. I believe it was in Detroit. It was Detroit or Chicago. I don't remember now. So I asked her to sit in the chair for just a minute. I looked at her teeth, and I said, if you don't mind, before you go out of town, if I could just make this appliance for you and see if you know, how it works. We made the appliance, put it in her mouth, and to make a long story short, she never went on this trip to Detroit. We got rid of all her headaches.
Wow.
And
Wow.
so they were, of course, they were doing CT scans. They're looking for vascular problems or you know, tumors or anything else that are going on possibly in the brain, and it was all related to clenching and grinding. I've had another patient, we were talking about sinus infections. I had another patient, we ended up rebuilding her bite through crowns and veneers and this nature. And before we started, she told me that she gets 3 to 4 serious sinus infections every year. And I said, we'll be really interested to see when we're done here if your sinus infections ever go away. And I told her if they did, she was going to owe me a gift. And sure enough, when we finished, it's been about 5 years now since we finished our case. She has not had one sinus infection since then.
Wow. Did she give you the gift?
No, you know, she ended up saying that I was supposed to give her the gift. And I ended up doing it. I got her some flowers and some movie passes or something like that and gave it to her.
That's a ripoff.
Yeah. Some other cases that I think about, I've had patients that have had all sorts of neck surgeries and problems. We ended up rebuilding their bites, and all their neck pains went away. They've gone through previous surgeries. I've had that have had every single tooth in their mouth root canal thinking it was tooth pain. And when we actually look at the bite, we're able to cure these things. As I mentioned earlier, we had a case just about 2 months ago that came in, and she was having numbness in her hands and all the way around her mouth, lips, and just all in general around it. And when we treated her from a neuromuscular standpoint, when we put her in the appliance to correct her bite, her numbness went away instantly.
What do you mean instantly?
She called me the next day and it was all gone. So,
wow.
And we continue to get these results. I'm always amazed what we've been able to accomplish. You know, I always go in saying, I hope we can help with these headaches. I hope we can help with the neck pain. I hope we can help with this numbness. And the further I go, the further I keep going down. Neuromuscular dentists and LVI, this Las Vegas Institute, will tell you they've even treated lower back pain, pain in the feet, legs, and I just haven't gone that far yet. I've gone down to the hands and the numbness there, and I continue to say, okay, what other symptoms did you have before? Are they better? And I keep getting astounded and amazed at the results we're getting.
Did you say that some feet problems can be related to things going on in your mouth?
Well, I know at Las Vegas Institute, where they teach this and where I've taken a lot of courses out there, they do. They say they've been able to treat and numbness and everything else there. I have, from my own personal practice and my patients, I have not gone that far yet. So I'm happy if I can treat the headaches and the neck pain and prevent the medications that they're on. We see so many patients that just have debilitating headaches and could be on 3, 4, 5 different medications, and we give them this appliance, and next thing you know, they don't need those medications anymore. And I think from all of our standpoints, that's our goal. We want us to be as healthy as we can and to get off all the medications that we don't need.
Mm-hmm.
And I would say it's truly a problem in today's society. I mean, we all know that we are prescribed a lot of medications that we might be able to get off of from what you're teaching. You know,
right.
eating better, staying healthy. So that's a great feeling when we can do that.
Right, right. Now, is there like a directory where people can go to find out people who are like you, who have been trained in these areas, if people have these problems?
Yeah, the Las Vegas Institute, I think it's lvilive.com. lvilive.com.
Okay.
If you can't find it that way, just look up Las Vegas Institute. And they are the foremost when it comes to teaching about neuromuscular dentistry, and they should have a list of basically all dentists who have trained there and learned. With the centric elation or Pankey philosophy, I don't know their website, but I'm sure you could get on Google and just look up Pankey Institute, and that they would do the same thing. So either way, if you're looking at any doctor that's taking this type of training, you're looking at a guy that's gone way beyond what dental school teaches and is really trying to learn the very best and provide the patients the very best. And I don't think you can go wrong with a dentist like that. Is there any other questions on clenching and grinding and TMJ?
Hang on, let me just check real quick. Someone was asking if there's a slide or a picture to see the appliance.
You know what? I did not include it. There's a couple different appliances out there. The main one is going to cover either your top or bottom teeth. It's made out of an acrylic material, so it's very hard. The key to it, because in the beginning you could go to a drugstore and buy a mouth guard and put it in between your teeth and it's going to work. The problem with the mouth guard is that it's soft, so over time your mind starts to realize, hey, I've got something soft in my mouth, and so this is something I can chew on also. And something soft, you can potentially dislocate your joint at that point in time by putting so much stress on that chewy appliance. So it needs to be something hard, and then the key to it is the dentist needs to create the perfect bite on it. So every tooth needs to hit that thing evenly and create that perfect bite, so we're quote-unquote fooling the mind to where it's not trying to do it itself. Does that make sense?
Yeah, yeah. So someone was asking, I guess you've already answered that, but she says, how do I know if my dentist knows about neck pain being connected with my teeth? and knows what to do. Are most dentists aware of this?
I hate to answer this question, but I'd have to say that no, most dentists are not aware of this. It's not something we're really taught about in school. Some schools will touch on the subject, but not go into the depth that they really need to. I would look at, you can always ask the dentist, ask about his credentials, just ask about your neck pain. If he doesn't put any correlation to it, he probably has never received the training and just doesn't know. And I hate that that's out there, but it is true. And so these are the two places really, and these are the two philosophies, the centric relation and neuromuscular approach. And the reality is they don't like each other. So one's going to bash the other. And luckily I've had training in both, and I think they're both right in certain cases. But asking
Isn't that funny? Isn't that funny how almost every field in medicine you're going to find different opposing forces, fields, all attacking each other. It's just amazing.
Yeah, it's always going to be that way. This is one, but this isn't near as bad as the amalgam and silver fillings that we're about to talk about. That has been a heated debate for a very long time. But I think this right here, of course we talked about periodontal disease, gum disease, and how it's linked to the body. This right here, I think, as more and more dentists learn it, is going to become huge in dentistry. The idea that I can get patients off all these pain medications and prevent surgeries and everything else is going to be probably the big breakthrough in dentistry 10 years down the road when more know about it.
All right, before we move on, tinnitus, or is it tinnitus? How do you pronounce that?
Tinnitus, ringing in the ears.
Is that connected to TMJ, or are you getting to it?
Yeah, it can be. So we were talking about stuffy or ringing ears earlier. That's one of the signs and symptoms. A lot of times a person will go to their ENT, they'll look, and they won't see any sort of problems or inner ear infections or anything else. So the temporomandibular joint itself sits right up next to the ear canal, and as it gets inflamed, you get that stuffy ringing ear feeling, and so a lot of times it is related to TMJ.
Got it. Okay. All right. I think we can move on.
Okay. Yes. Chichen Itza, outside Cancun, Mexico. All right, so the last thing I want to talk about here today is going to be amalgam or silver fillings. And as I previously mentioned, there has been a tremendous amount of debate about this product in the dental community for years now. And if you want to see arguments almost like politicians throwing fists, this is the subject in dentistry where it's going to happen. I want to start with my thoughts on amalgam. Amalgam is 50% mercury. And from that standpoint alone, I don't think the product should be used anymore. This mercury is leaking out of the filling. It is increasing the amount of mercury in your body. We all know that mercury is a poison, so why would we want this in our mouth? My thought on amalgam is that it fractures teeth. It is a metallic material, so it expands and contracts with heat and cold. So when you have it set inside of a hole in a tooth and it expands, it puts pressure on the natural tooth, causes it to crack, and then part of the tooth breaks off one day when you bite down, and it leads to a lot of unnecessary dentistry from crowns, root canals, and you potentially could lose the tooth and end up needing implants, bridges, and just a lot of unnecessary stuff. And last but not least, it leaks. So I've been taking silver fillings out for 12 years, and it's never ceased to amaze me how much cavities we find underneath them. And I always said that under about 80 to 90% of them, I found cavities. Makes sense. Again, it expands and contracts, so it pulls away from the tooth, and you get these gaps, and this microscopic bacteria gets underneath it and starts a cavity. So the big debate, and I just think it shouldn't be used anymore. So the big debate from the American Dental Association, what was their thoughts on amalgam? In their defense, what they always said is that it's a product that has been used for over 100 years with a great track record. Well, that's great that we're still using a product that's over 100 years, but I think we've advanced a little bit in the meantime.
Mm-hmm.
It's inexpensive and can be placed in a wet environment. This is the comment I hear by most pro-amalgam dentists. It's just cheap, so they like that, but when we're doing any restoration, we want it dry. We don't want saliva, bacteria underneath the filling. And so with the materials we're trying to get to and the ones I use, it's difficult sometimes in the very back of the mouth to keep it dry. And so for these dentists to always say this, and we're having a discussion, not an argument, but a discussion on this, I asked them at this point in time when they say this, I said, well, if you can put it in a wet environment, you're telling me that you've got saliva and bacteria underneath your filling. Aren't you telling me that your filling has failed from the very beginning? And if you didn't think it was failed, there's only one reason why. And I'm waiting for them to say it, is because they know the mercury's leaking out of the filling and it is killing the bacteria underneath it. And so after that, I get a lot of ugly looks and they tend to walk. The ADA has always said it's a safe product to use. It's got a great track record. So what are some of the national thoughts on amalgam? I've been very fortunate and I've been involved with some of the politics and I've been head of some committees and stuff, so I kind of knew the inside thoughts and what everybody was trying to do and what the states were trying to implement. And there are many documented mercury poisoning cases, and I'm going to show you one. The states, individual states, were actually trying to adopt consent forms. These are things every state was trying to do, and where I live, Alabama was one of them, where they were saying if a dentist uses amalgam, the patient was going to have to sign a consent form that says you were about to receive a product that contains mercury, a known poison, and go into this long spill, and the patient was going to have to sign it saying they were going to use it. No state has ever adopted that form, though. Every state is talking about developing amalgam restrictions, and so is the FDA. Basically, before it's all over, I think every dental office will have to have certain filters in their office that prevents any silver fillings or mercury that gets in our water lines from getting into the main public water lines. Again, all this is happening at the same time as the ADA and everybody else is trying to tell us that it's safe, but behind the scenes they're developing all these restrictions. The FDA has been coming out with a new warning. We've been waiting for it since Dr. Dave received my PowerPoint presentation here. The FDA made their ruling, and that was on July 27th or 28th. I'll go ahead and tell you what it is now because it's the biggest news in dentistry and nobody's hearing about it right now. The FDA has now come out and has changed the status of amalgams. It has changed it from a Class 1 product, meaning it was a low-risk device, to a Class 2 device, meaning it is a moderate-risk product. It will not go any higher than that. The only other place it can go to is Class 3, and that's a very highly dangerous product. If we go to that point, I don't think it'll ever get there because of it would be the biggest class action lawsuit ever if that were to happen.
Yeah.
So there's over 1 billion silver fillings out there, and it would be unbelievable. It would probably destroy dentistry at that point.
You'd probably make a lot of lawyers happy too.
It would, but I think that's the reason you will not see it go any higher than this. But from that standpoint, I think they've made their point that the future of amalgam is on its way out. It shouldn't be used anymore. We know it, and I think that's as far as you're going to see it go. And I think the dental schools and everything else will stop teaching how to use it and just move on to different types of restorations. So now that this new FDA ruling came out, what I'm about to speak about kind of is hindsight now, but I'll go ahead and tell you about it. Until this past week, the ADA statements on mercury, the way they approached it in the beginning was that they said mercury did not leak out of the fillings. It was bound inside of it and didn't leak out. And dentists like myself always said, sure, it's leaking out. We kept proving the points, and they're like, okay, it does leak out in very small amounts, but it's not a big deal. And then we kept arguing, and they said, okay, we admit it's coming out in large amounts, but it's metallic mercury, not methylated mercury, which is the thing that everybody's so scared about. Well, without getting too detailed here, yeah, there's three different types of mercury. There's metallic mercury or elemental mercury, and this is what amalgam is in. There's particle bound, and there's also oxidized or ionic mercury. All these different products from factories, from dental amalgams and other places, when the mercury leaks out, gets in the air or into a water line, it ends up in lakes and oceans. And it's microscopic bacteria in these bodies of water that convert those different mercuries into methylated mercury or methylmercury. And then from there, you start with the algae and the plankton, and it eats it, and the bigger fish eat that, and it goes up the food chain to where the tunas and are eating the smaller fish, and that's where we are eating those, and the concentrations in these fish is tremendous, and that's where our concern with mercury is occurring. And it's estimated at this time that over 300,000 newborns every year are at increased risk of learning disabilities associated with in utero exposure to methylmercury. So that's why we're hearing all the concern, and that's why we're only allowed to eat so much fish a week and being told all these restrictions. So even though the ADA has been saying all this time that, you know, the mercury is not a problem, and it started off like it doesn't leak out at all, to finally saying, yeah, it does leak out in large amounts, it's a different mercury, we can prove in every way that that's wrong, and then behind the scenes the ADA has been always trying to get restrictions on it to make sure that the mercury from our offices are not leaking out into the public water lines. And I kind of put my own defense up here when the ADA said that mercury doesn't leak out. This is actually an appliance for snoring and sleep apnea. If we want, at the end here, we can talk about that some, but that could be a whole other discussion or lecture if I do okay today. But I think you can look at this and you can see exactly where the two silver fillings are in this person's mouth. So picture says 1,000 words. Obviously, these things are leaking. This was something I took off from the Michigan State University Office of Radiation, Chemical and Biological Safety. There was the website. I'll read it for you. Accidents have resulted in several cases of mercury poisoning in Michigan in the past 2 years. 4 members of a Lincoln Park family were killed after one member attempted to refine dental amalgam, silver fillings, in his home while attempting to recover the silver. High levels of mercury were found throughout the house, including wrapped food inside the freezer. The entire house had to be demolished and disposed of in a hazardous waste landfill.
Wow. Wow.
But of course, it's not, from the ADA standpoint, it's not a problem. You know, it's safe to continue to put in our mouths. The World Health Organization, this came off their website, and basically this graph just says that the higher number of silver fillings, the higher amount of mercury concentration in the brain. Okay, so as a person had more silver fillings in their mouth, there was more mercury found in the brain. Now the funny part about this is for some reason alcoholics had less mercury in their brain than the non-alcoholics. I'll leave that up to you what you should do.
Drink more alcohol, huh? Golly. I wonder.
Now this is something, of course, a patient never sees. This was the label. I'm sure it's changed now. When we buy the amalgam product, this is on it. And the very beginning of it says, this dental amalgam product contains mercury. The placement of a dental amalgam in a patient will increase the level of mercury in the body. And it goes on to say the use of a rubber dam may decrease the amount of mercury absorbed by a patient during the removal or placement of an amalgam. The health authorities of various countries, including Canada, Germany, France, United Kingdom, Norway, and Austria, have recommended against the placement or removal of an amalgam in certain individuals such as pregnant and nursing women and persons with impaired kidney function. Since this came out, I have not bought this material in years. This is 5-10 years old when I stole it from somebody. Since that time, in January of 2008, Norway and Sweden have completely banned amalgam. In April of 2008, Denmark completely banned amalgam. Germany has gone on to ban types of amalgam. Canada has limited the amounts of silver fillings an adult can have to 4 and kids to 1. And most countries are now adopting to where it should not be given to young kids or pregnant females. So you can't buy, I mean, if you think about it, you can't use a thermometer or even find a thermometer that has mercury in it. And so why is it not, it's not, they took them off the market because it's unsafe for us to have a mercury thermometer and the problems we can have there, but for some reason it's still okay for us to put mercury into our teeth and into our body. We could go into all the problems here that it says about mercury and what it causes, but it causes everything from kidney damage. Everything gets affected by it, but some of the biggest problems are the learning disabilities and the neurological problems that occur from high levels of mercury. Now, a lot of dentists that still use amalgam and stuff, they try to tell you it doesn't fracture teeth. As I routinely take out silver fillings, these are just pictures I can't help but show. We always see cracks going around the fillings. They just expand and cause the tooth to crack. You can see a crack here, see a crack here, here, here. Well, if you look closely, you notice that this crack goes straight through here, straight through the middle of the tooth, and back out. This is where the nerve sits. And it has actually split this tooth. This person, in the end, is going to lose this tooth because of one small silver filling. Same here. We have removed the silver filling. You can see a fracture line here, going straight through the tooth, coming across here, coming back out over here. Again, the chances of saving this tooth are very slim. We're at least looking at root canals and crowns before it's all over.
Dr. Luna, when somebody's teeth look like that, are they in much pain? I mean, I guess I think I asked that question before, and David asked it. I typed it to him. It just looks so painful.
It's amazing. Like the picture I have up now, we see this every day, and typically there's no pain associated with this.
Wow.
And I've always tried to figure out why. As a dentist doing root canals, there's many times we've had a silver filling. We'll go in and we go to where the nerve of the tooth sits, and we take out the nerve. That's what a root canal is. And we can tell that it's been very dry and dead for a long time. So I have a feeling that in situations like this one here with this large silver filling in the tooth, even though half this tooth broke off, the nerve's probably been dead in this tooth for a while, and that's why there's no pain.
Okay, that makes sense.
And we have a lot of dentists, of course, that will try to tell you that the newer products we're using, which we're going to talk about in a second, they're not as strong as silver fillings. Okay, I can agree to that. That's fine. This product is very strong. It's metal. Here it is. It's sitting here, but the problem is it looks fine, but the rest of the tooth broke off. So you can tell me it's strong, but it's in a sense it's too strong.
Yeah.
Right.
Yeah.
So this person here is now leading to potential root canals and crowns and thousands of dollars worth of treatment that could have been prevented if they just didn't have that silver filling in there in the first place.
And not to mention the damage it's doing to the rest of the body. I mean, do we know anything about the exact effect is the word, of mercury on things like the cardiovascular system and the nervous system, things like that?
Well, we do. There's a whole list of problems, and I can go back. Of course, everybody now is worried about autism and everything else with their young kids, to Alzheimer's, and we can go through half this list. But if you were to Google it again, you'd be amazed at all the concerns with mercury. But it can cause everything from eye problems to nerve problems, nephrotoxic. We keep going to just irritations of the skins. Obviously, it's causing irritations of the vascular system, the lungs themselves, and the biggest problem we talk about is mercurialism, when the mercury levels get extremely high, and the symptoms are different, but they're listed here, including tremors, salivations, stomatitis, loosening of teeth, blue lines on gums, pain, and numbness in extremities. A lot of neuromuscular issues going on. I think the list is so long that That'll be a whole night of just talking about it by itself. And I by no means claim to be a mercury expert. I more just say I know it's a problem. It's obvious it's a problem and why, and it just should be removed. And the really interesting aspect of this is some of the results we've seen with patients again as they have their silver fillings removed. My wife had a hyperthyroid, and she actually was not taking her medication at the time and wanted her silver fillings removed just for a cosmetic reason. We removed her silver fillings. Next time she went back to her physician and checked her thyroid levels, everything is self-regulated. Her thyroid was normal. I've had patients that had debilitating headaches again, took out the silver fillings, and she waited a year to write me the letter. She said the very next day after you removed these silver fillings, I did not have a headache since that day on for an entire year.
Really?
We have a patient that's our patient. We didn't actually do the treatment, but she was seeing a dentist in Atlanta at the time. It's another dentist who's real big anti-amalgam. They removed all her silver fillings, and she had lupus, and her lupus went away. And they're documenting the case. They did all this research on it. I never finally asked her what happened with it, but I have that dentist's name, and I've always meant to contact him to see his results.
Dr. Luna, what's being done to let physicians in other fields know that maybe they should check out what's going on in someone's mouth?
You just hit the biggest sore spot of all with me. This is something we don't really get to talk about. You're not going to see me write about it much. The dental board in Alabama doesn't like it when I say anything about it. The American Dental Association is not real keen on it either. It's been difficult to say a whole lot. You put it in print, and then they come in after you, and they're trying to find you. I mean, they've tried to find me many times.
So it's the dental industry itself that's stopping the information getting out to other medical professionals?
Correct. So that's why I like to go and lecture and talk about this as often as I can, just so people know.
Right.
Now, there's no way now that like the state board here or the American Dental Association can say much to me, as the FDA just came out with their release a week ago, and I'll say, hey, look, the product's no longer considered a low-risk product. It's a moderate risk, and that's in my patient's behalf. I have to let them know.
Well, we'll just get this webinar recording out to them all.
That's
right. Right. Now let me ask you this: if once the filling has been removed and replaced with something safer, does that automatically mean that the body's going to get rid of all the mercury that has already leached into the system, or there's something else that needs to be done where that's concerned?
From the silver filling standpoint, pretty much yes. And I'm going to bring that up in just a second.
Okay.
The other thing that most dentists and people will argue with me is I tell them that silver fillings leak. You know, it's one of the 3 reasons why I said this product should not be used anymore. So for most dentists, they're going to look at these silver fillings here, and they consider those normal fillings, no problems, small fracture lines. And when we take them out, you can just see all the black and all the issues that are going on underneath it. Another example, this is a person that just wanted their silver fillings removed for cosmetic reasons only. We took the fillings out, and we found big cavities, huge cavity, huge cavity. You know, and they never would have known these would have continued to grow underneath the silver fillings. Eventually would get to the nerve of the tooth, cause a root canal, and end up needing the root canal and crown and all the pain that goes along with that. A lot of unnecessary expenses.
Again, it's the mercury leaching out of the filling that's causing the cavity. Is that what you're saying?
It can be. The mercury itself, I have a feeling, is destroying the nerve in the tooth and causing the nerve to die. Okay. But also from the standpoint of the tooth, the restoration expands and causes the tooth to crack, or when it causes these cracks, then the bacteria can get in between the cracks and get underneath there and start a cavity. Besides the fact that one of the reasons dentists always like the product, as we mentioned before, is they said, well, we can put it in a wet environment. So from the very beginning, they left saliva and bacteria underneath the filling. And so those are all reasons why these cavities are underneath there.
I have a question from one of our attendees saying, Dr. Luna still refers to silver fillings, but in reality, there's no silver in amalgam fillings, correct?
No, that's not true. There is still silver in them. Yeah, 50% of the filling is mercury. The rest is made up of products such as silver, tin, copper, nickel, and zinc.
And do those also have problems, or are those are relatively safer than mercury, right?
Well, I mean, silver can obviously be somewhat of an issue. One of the big ones that's in there is nickel. As I've read reports saying that 20% of all women are allergic to nickel. So if you're a woman and you sometimes buy cheap jewelry and you have a reaction on your ears to it, most of that cheap jewelry has nickel in it, and you might be allergic to it.
Okay. I have been diagnosed with chronic fatigue and have recently been told that my brain fog is probably from my fillings. Would you agree with this?
I still have a hard time saying with 100% certainty, sure. There's a lot of other issues that can be going on, so I'm not going to say that just by removing our silver fillings we're going to cure the world. Mm-hmm. But it definitely can be a contributing factor, and as I continue to remove silver fillings and amalgam, it's kind of like TMJ. I continue to get amazed at the symptoms or illnesses that people have going away and just in general feeling much better. So obviously who this person is seeing is somebody that's interested in the mercury that's in the silver fillings and thinks it can be a very strong contributing factor. And so sure, I would, from the standpoint of the teeth alone, I recommend getting silver fillings removed. But if you have an issue like that and someone is already telling you that when they want to remove the silver fillings, I would have high hopes that that's going to help.
Okay. And someone's asking what the blackness in the teeth is. That's the cavity from the decay of the bacteria, right?
Yes, it is. That's cavities you're looking at.
Okay. Well, like you said, this is a very interesting topic, and we could go on with that, but let's
keep moving.
Keep moving, yeah.
All right, so yeah. One of the, as I said earlier, it seemed like under all the silver fillings I've been replacing, I would find cavity under 80% of them. And that was just a number I was throwing out there just by sitting in my practice and looking. So Las Vegas Institute actually did a study about 2 years ago. They removed 340 amalgams. Under 67% of them, they found cavities. Okay, what was even more interesting is of that 67%, 16% of them had gross decay, meaning by that you could take a little instrument and just scoop the decay out because the tooth was so soft. And so everything I've been saying for the last 12 years, they did a study, and their number, I said 80%, but I wasn't truly counting. They found it under 67%, so it was very close. And so for the questions, what are some of our options? Of course, there's always you take it out and there's cavity, there's always the option of putting another one in there. I hope by now I've shown that that should never be done. Composite is a white filling. That's what you hear most people say, or porcelain filling. It's usually composite. It's a resin-based material. It does not have any of the problems of amalgam. It does not contain any mercury. It does not expand or contract, so it's not going to cause the tooth to break. And because it's chemically bonded to the tooth, there's a seal between the filling and the tooth itself, so it just cannot leak. We have other options, which is gold, and there's nothing wrong with that. Or if they're doing crowns, porcelain-fused metal crowns, I really don't do any of that. I try to avoid any metal at all in my practice. And all ceramic crowns. The interesting, I just wanted to throw this in there because there's such a big debate about silver fillings. In the American textbook of operative dentistry, there was a Dr. William Christensen who wrote, the best restoration in dentistry is a porcelain inlay. And the kicker here was the year he did this, 1897. The reality is we knew way back then that amalgam was not the best restoration available. And I read an article once, but I did not verify it, that amalgam was actually going to be banned at one point in time and then ended up getting grandfathered back in. So 100 years ago, they'd already thought about getting rid of the product. Somehow or another, it got grandfathered in the past, It's been around all this time. And now we're finally starting to see some stricter regulations being put on the product. So I hope you can look at this and see that this product can cause all sorts of problems, not even just counting teeth, because it can break the teeth and cause all sorts of unnecessary dentistry, but from the standpoint that it is leaking mercury, it is increasing the amount of mercury in your body, and that can be causing all sorts of neurological problems. Why would you want it when you could have a material like this that does not contain mercury, does not expand and contract and break tooth, does not leak, and last but not least, it looks a whole heck of a lot better. So for those dentists who say, the silver filling is a stronger material, these materials have about the same strength as enamel. So the reality is they kind of rebuild their tooth back to their natural strength compared to weakening it like an amalgam does. And I think this picture here shows everything that a silver filling is a problem of. On the left here, you can see how it's pulled away from the tooth, and that's a massive gap. So you can understand how it can leak and get bacteria underneath it. This tooth just broke from the silver filling that was in it, so they tend to break teeth. This tooth over here had a silver filling, but they've been to a dentist and had a root canal done. So it kind of sums it up that it can cause a lot of unnecessary dentistry with root canals, it can break teeth, and they tend to leak. Well, why would we want that when we could have this? Again, these materials don't have any of those problems that amalgams do, and obviously look a lot better too.
Absolutely. I mean, you can almost do that in a cosmetic way, actually. That looks so natural. The last slide you showed.
Of course, everybody nowadays too is wanting to look the best they can. So, from a cosmetic standpoint, we remove a lot of them just for that reason alone. Of course, we always talk with all our patients about the possible problems with silver fillings. We don't force it, but we give them the option. We let them know our thoughts and philosophies, and then they make that decision from there. But
what's the risk? What's the risk involved in actually removing a mercury filling? I mean, isn't there the chance that the mercury is going to leak into the system when you cut? I mean, there's going to be some bleeding somewhere, right?
Yes, and that's what we're here to now.
Okay.
The pro amalgam dentists are always going to try to tell you, well, you're just damaging the tooth more by removing it. If you're saying mercury's a problem, well, now you're causing the mercury to potentially enter the body. And that's true. To sum it up, there's a lot of dentists that are anti-amalgam, and they're all coming out with protocols on the way that amalgam should be removed. In general, most dentists who are anti-amalgam will agree with a couple things. One is a rubber dam. It's a sheet that goes around the teeth and isolates that tooth where, as the pieces come out and the water and everything else, it doesn't go down your throat. You're not going to swallow it. While we have that rubber dam on there, you hear about laughing gas. If you've ever been to the dentist, it's a nose piece, and we give oxygen so that you're breathing in pure oxygen while we're doing this procedure. We use high-volume suctions, so we have them right next to the tooth as we're taking out the silver filling. We're making sure we get everything up, as much vapor and pieces as we can right then and there. And we try to remove these silver fillings in chunks. It doesn't take a whole lot to remove a silver filling. You can almost put a groove right down the middle of it, and the whole thing just pops out of the mouth. There's debate on, there's a lot of people who say you should only remove a few at a time. They say 2 at a time is all you want to remove. That's not my philosophy. My philosophy personally is the faster I get them all out, the faster you're mercury free. But that philosophy differs between dentists, and I don't have any. I think it's okay if they say take a few out. From my standpoint, just get them out as fast as possible. There is a vitamin C you can take by IV, or you can take a massive dose orally. IV is a little bit better, but there are studies out there showing that the vitamin C will bind to any mercury that does happen to get in your blood system when you're taking these out. And then the last question, which you asked earlier, Dr. Dave, was, when we take them out, does the mercury level increase in the body? Studies show yes, it does. When you take them out, you get an initial spike in your blood system, and then within a few days to a week, all your mercury levels have dropped off to basically nothing. So when we take them out, we do get a spike, but it drops off and is excreted from the body quickly. And so the whole philosophy there is you want to get it out as fast as you can. In a couple of days, your mercury levels will be much lower, or you're going to keep the product in there and continuously have a leaking mercury product and continuously leaking into your system. So another thing we do is we work with some physicians here in town, holistic type approaches, and they'll look at all the metal levels in the blood system, and sometimes they need chelation therapy. So they have a lot of other metal toxicities and everything else going on that will be done too to help flush them out of the system. So those are most the standard ways that's becoming nationally recognized as to how to remove a silver filling. Does everybody do it every time? No. Some people have problems with the very first thing, which is a rubber dam. They're very claustrophobic, and it's hard for them to wear it. So again, from my philosophy, the sooner we get them out, the better off we are. And I know that within a few days, your mercury levels are going to be much lower than before we started. I believe that was it. Yeah. So any questions on mercury fillings, silver fillings?
Are you kidding?
Like I said, this is usually where they start rolling it.
Oh, well, they've been rolling it a long time ago. Is there no space here for these questions? For Pete's sake?
If we can't answer them all, obviously, what I would like everybody to get out of it is, from a dental standpoint, these silver fillings are damaging the teeth, breaking the teeth, and causing a lot of unnecessary dentistry. And we have products out there that, just from a dental standpoint alone, don't break teeth and won't cause these problems. From a medical standpoint, of course, it is a product that contains mercury, and it is a fact that is leaking out and is now, just in the last few days, been changed from a low-risk product to a moderate-risk product. It will not go any higher than that, just because of my idea of the class action lawsuits that would occur. And in essence, every dental school and every governing body is trying to just weed this product out. So over the years, you're going to see it slowly disappear as we have so much better products, and before the fact that it contains mercury. And we all know the concerns that we see with eating fish and where all the mercury is coming from. So the factories, the cars, and the dental industry are looked at a lot.
Well, speaking about mercury and heavy metals, before we go into all these questions, and Sherry, I'm going to need your help here because we're going to have to go back and forth. Because of what we do with the webinars, and I just want to put a plug in here, Dr. Luna, we once had a scientist come speak about the zeolites. Zeolites would be, have you heard of them, Dr. Luna?
No, I have not.
Okay. Well, they're minerals, but they're a natural way there's a company that produces them and produces a solution of them. And they are a harmless way. I mean, it doesn't involve even chelation therapy, but it seems to be even a lot more effective than chelation therapy because they harmlessly remove not just the mercury, but also other heavy metals like cadmium and lead from the body, and you actually see the spike in your urine after you take these things. So what I wanted to encourage you folks to do is that, like what Luna said, if you have mercury fillings in your teeth, you want to get to the right expert who can safely remove those fillings for you and replace them with something safer. But also, you want to also take something that is safe and it's cheap, really, from what I can see. It's a cheap way of helping take care of the system, remove the other heavy metals in the system. Of course, mercury and lead being the major ones. The difference between this type and chelation is that chelation sometimes also removes the good minerals as well. This one does not, and so it's something you can do on your own. You don't have to go to a naturopath or a holistic medicine person where you're going to have to pay a lot more money. You can do this on your own. It's a safe way to do it, and the information on it is on our website. The title is called The Science of the Detoxification, and Rick Deitch, a biochemist, did a full 2-hour talk on it, and the slides and MP3s and all the PowerPoints are available on the website. Okay, let's get into it. I tried to put this up as much as possible because there are so many questions. Okay, Sherry, why don't you take some of them out of... Did you want me to copy and paste them for you, or what? Sherry.
Okay, I'll ask a few.
Okay.
Let's see. Okay.
I go one.
Is there any treatment for the damage to the lower teeth? It says, I now have a top denture.
So with the denture, saying if it's going to damage the lower teeth?
Well, it sounds, is there treatment for the damage to the lower teeth? I now have a top denture. So I'm not sure if it's the top denture that's damaging the lower teeth or...
Yeah, it would depend, of course, on the material of the denture. If it was a porcelain material, which some dentists will use, it is possible that that material is abrasive and wearing down the other teeth. I would probably say that that's not likely, and I wouldn't expect a denture, because it's a weaker material than the tooth itself, to be causing too much damage.
Okay. Somebody says they have a drawer full of appliances that they've tried. They've seen a dentist about TMJ, and they still have headaches.
I guess my question there is the type of headache it is still. Obviously, not all headaches are created from clenching and grinding. So when I have a patient who has a lot of headaches, I ask them a couple questions, and I see signs in the mouth, if they have worn down teeth or missing teeth, I first tell them to go home and ask themselves throughout the day, are their teeth touching? The reality is teeth should never touch unless you're eating. If you're sitting up and your muscles are relaxed, gravity will hold your teeth apart. If you're sitting there working, driving, anything, and you notice your teeth are together, you are actively clenching right then and there. When you go to bed, of course, you will clench 5 times harder than when you're awake and not be aware of it, and that's when most of the damage occurs.
That is very interesting, because I think if somebody had, I wouldn't have thought I was clenching my teeth just because they were touching. And so that's a really practical thing to do, just to relax your mouth enough your teeth aren't touching.
Yeah. And of course, during the day, we can get you to control it, and that's where the appliance comes in that most people wear in their sleep when you cannot control it.
Okay.
For this individual, if they're having the headaches, if they're waking up in the mornings with headache, an appliance should take care of all that. If they're getting headaches, not in the morning or night, but during the middle of the day, it could be something that's postural related. If they're sitting in front of a computer all day, have a vision problem or something else. And then they bought a bunch of different appliances. Again, if they bought over-the-counter appliances, they really don't work from a long-term standpoint. A dentist needs to make it, and then the next problem you have is a lot of dentists will make them, but they don't know how to adjust them. So they make an appliance, they give it to you, stick it in your mouth, and tell you to go home. But if this individual's appliance has ridges all in it on the chewing surface, that chewing surface should be perfectly smooth.
Okay.
So that the mind and the teeth have nothing to clench on. There's no ridges, nothing there to catch on.
Okay, okay. Well, I'm sure if everybody could, they would come make you be their dentist, but not everybody can come to Alabama. So do you have a suggestion for people who are looking for a dentist that maybe has this kind of expertise, out? Do you have any just recommendations?
I probably do. As we previously mentioned, the Pankey Institute, which is spelled Pankey, they have a ton of dentists that have gone there and learned from there, and they will be able to refer to dentists in their area.
Okay.
The Las Vegas Institute, I think was lvilive.com. They're a different philosophy, but again, we're talking about dentists who are spending a lot of money, taking a lot of time out of their schedule to learn high-end advanced dentistry. They'll have a list of dentists in the area that could help. And another institute I would talk about would be the AACD.com, the American Academy of Cosmetic Dentistry. Again, that's another institute where you're, in general, looking at dentists that are trying to do things better.
Okay, thank you. That's helpful. I'm going to ask this question that's multiple parts, so I'll just start. It says, what is the best, most helpful, and least expensive way to remove the say it for me,
Amalgam?
Yeah, thank you, fillings. And what's the current average financial cost to do that? This is a 50-year-old man, and he said about 60% of his teeth have that, so it's going to be quite a process.
Yeah. Of course, composite is the resin-based material. It would be the first material of choice to use to replace amalgam. If the amalgam is very, very large, the dentist may say he has to do a onlay, which is a partial crown, or a full crown, at which time I would still recommend something all ceramic, something all porcelain. A lot of insurance companies, if he happens to have insurance, will pay to have them removed. Sometimes what's been interesting in the past, and that might change now that the FDA has changed the ruling, is the insurance company would pay the amount to have a silver filling done because they pay a little bit less than a composite or white filling. The difference usually is only $30, $40. So if you have insurance, typically you're looking at maybe $40 give or take per tooth to have it replaced.
Okay. And you may have answered this next part of the question with how you answered the first part. It says, what replacement media lasts longer than diamond composite media?
Well, diamond composite might be a little misnomer. Composite, there's different types of composite materials. In general, they've all gotten to a certain strength now where the strength is about the same as enamel, or the outer surface of the tooth.
Okay.
So pretty much any dentist at this point in time who's using composite has to be using a material that is about the same strength as natural tooth, and should not be an issue.
Okay, there's two more shorter questions within this. Wondering if you've studied CoQ10 and its relations to periodontal disease.
I'm just starting to look into it, so I hate to say too much about it at this point in time, but it is something I'm trying to read more about. Again, from my standpoint, I'm not the research kind of doctor. I always look at a big picture compared to getting dialed into all the little small details of stuff. So right now my biggest thing has been mercury. I know it's a massive problem, and TMJ and the bite issues, and also sleep apnea and snoring. I love to treat that. Fluoride is another question that's coming up a lot in the CQ10 and all these things. Again, the zeolites is something that's brought up. Every time I give this, there's something I'm like, I got to read more about this. I got to learn what I can. So at this point in time, it's impossible for me to make an educated answer to that question.
Well, Doc, anytime you have any questions, or if you want to see any of our stuff and to read or watch, just let me know, and we'll send you stuff over, okay?
Oh, well, I'll probably be on your website for the next 3 hours tonight already.
Okay, the last part of this question says, is it good to gargle with hydrogen peroxide?
I think from a short-term standpoint, it's not a problem. If you're doing it 3-4 times a day, you have the potential of killing not only bad bacteria but good bacteria also. So I'm okay with it as long as you're not getting excessive.
Okay. All right. Well, I have a long one here. Are you done with that one?
Yep.
Okay. I have a long one here. Obviously she's been waiting. So Ann is asking, I have had poor dental problems my whole life. TMJ, wore braces to help properly align my teeth. I lost upper teeth in my 40s as bacteria destroyed bone, gum, etc. Yikes. I now only have 7 upper teeth. 5 were filed down to fit a permanent bridge. My question is, would I be better off having these remaining teeth pulled as there is an underlying tooth infection that causes me to have an offensive bad breath, and I'm constantly or continually fighting to maintain these teeth? I'm resisting having all teeth pulled as my parents never wore their false teeth. Also, your teeth are pulled. Once your teeth are pulled, doesn't your bone recede? Would an older person be better off trying to maintain their teeth as long as possible, or would they be better off physically if they had all their teeth pulled and just wore dentures? Long one.
Yeah, from my standpoint, I will do everything I possibly can to save a tooth. Once they're right, once you lose a tooth, you have no possibility of getting it back. And they mentioned something there, when you lose a tooth, the jawbone starts to dissolve. So for other people to understand that, it's kind of like working out. As we work out, our muscles get bigger. As we stop working out, our muscles shrink. The same goes with our teeth. As we're putting pressure on our teeth, it puts pressure on the jawbone and keeps the jawbone thick and healthy. Once we lose a tooth, there's no pressure put on that jawbone, and it slowly continues to dissolve away. And so if you're young and have a tooth pulled, you could be 60, 70 years old and have a jawbone that's paper thin. And so if you fall down and break your jaw, and it's not even as thick as my pinky, the chances of ever fixing it correctly are going to be slim to none. And you're going to have a miserable rest of your life eating baby food.
Mm.
As for this individual, I would obviously, there's a bridge on there now. Obviously, the teeth that are holding the bridge have to be healthy. If they're not, then the bridge is not going to last. It's not a stable environment. So without seeing them, without seeing the x-rays, I can't say for sure, but obviously the gum disease has to be addressed and taken care of. And then make sure that there's no abscesses on the teeth that are anchoring that bridge in place. If all that's healthy, the only other problem they should be looking at would be the bite itself and making sure that it's stable and balanced. So from my standpoint in dentistry, a lot of dentists will look at only the individual tooth and fix that one tooth, and then go on to another tooth and fix that one tooth, go on to another tooth and fix it, and 5 years down the road they don't even realize, but they've caused a massive bite problem. I always try to look at the big picture first, where I want to get to, what I want to accomplish, and then address it that way, and how do I get there. And there's three main areas to look at. The gums have to be healthy. That's the foundation to everything. If they're not, nothing else is going to last. Then I look at the bite. If the bite is stable and the forces are being put on the teeth in the right position, everything's great. If we're missing teeth, we're now putting force on less teeth, trying to take more force, and so you're going to have a cascading effect of losing teeth. So we need that stable bite. And then last but not least is when I look at the individual teeth, the silver fillings, cavities, and stuff of that nature.
Does insurance cover removal?
Yes, in general it does. If you have a silver filling in there and you want to take it out, it will pay for it. Most of them at this point in time will pay for the silver filling fee of it, so you're looking at $30, $40 to take one out, probably out of pocket. Now that the FDA has come out with their new ruling, it's going to be interesting to see what insurance companies do. They may now be forced to pay for the full fee of removing the silver filling to a composite.
Okay. Jump in, Sherry, whenever you feel like. Is it advisable to supplement with high levels of vitamin C for those with fillings that have not been taken out?
Well, I mean, I wouldn't say that probably staying on massive doses of vitamin C over long periods of time is going to be good. That's probably a question Dr. Dave might be able to answer better than I could. Our recommendation is the higher level of vitamin C when the fillings are being removed to help bind to any mercury that we caused. That when we take it out, that spike we're talking about, we want that mercury to be bound to that vitamin C and excreted through the body as fast as it can be.
Okay, great.
Dr. Luna, I'm not sure if you've addressed this already. A couple of questions came in regarding fluoride in toothpaste. Is that something that is helpful or that you recommend or that causes any problems?
Yeah, right now I'm torn. Again, as I try to remove any harmful substances that I can, such as mercury, The question comes up about fluoride all the time, and from a dental standpoint, the benefits of fluoride are obvious. When we go into rural areas and help underprivileged people, you can see which counties do not have fluoridated water. The caries rate or cavities are rampant throughout the teeth. And when you get to an area where the water is fluoridated, you don't have many cavities anymore. Looking at statistics, since water started getting fluoridated, cavities have dramatically decreased in the general public. So from a dental standpoint, fluoride is a fantastic thing. Now, that being said, if a small child eats a whole tube of toothpaste, they could die from fluoride poisoning. And so I'm kind of torn and need to do more research myself on the effects that fluoride can have on the rest of the body.
Is there research being done about other substitutes for fluoride that would be as effective but that wouldn't have any harmful effects?
Well, right now there's toothpaste that are coming out. It's probably the wave of the future that contain products that are supposed to help remineralize the tooth. And what's happening to a tooth all day long is it's being attacked by acids. As we drink sodas, we eat food, and everything's broken down to these products. They can get broken down into acid, and that attacks the tooth. And the tooth is actually trying to remineralize throughout the day itself. We're seeing toothpaste now coming out that have products in them to help promote remineralization of the tooth and to balance out the acidic environment in the mouth. If we find that perfect product, then it could be a thing where they say, hey, we don't need fluoride anymore in the toothpaste. We're getting it in our water for development standpoint, that's fine. Now we got the toothpaste out here that are remineralizing the tooth, so we don't need it in the toothpaste. I could see that happening down the road, but we're not there yet.
Okay. In your bio, it mentioned that you treat people with snoring. Could you talk about that just a little bit, some of the treatments that you do for people who snore?
Sure. As we were talking about clenching and grinding of teeth, if you remember some of the pictures, we noticed that people's teeth were worn down. So they might be half the length that normally they were born with. So all this clenching and grinding wears our teeth down. It's my belief and philosophy that as the teeth wear down, it only makes sense, the top teeth are kind of angled. As our teeth wear down, our bottom jaw doesn't go straight up. It kind of goes up and back. And when it moves back, it is going to cause the tongue to go backwards. And at that point in time, it's going to close off the airway. And so you've got treatments now typically for snoring and sleep apnea, and really talking about sleep apnea here, where you stop breathing in your sleep, like the CPAP machine, which is basically is a mask trying to force oxygen into your blood system to keep your oxygen levels high. And then other procedures that have been done have included surgery, cutting off part of the soft palate, tonsils, and stuff of this nature in the upper airway to try to open it up so you can breathe better. The appliances that we make are based on CPR principles. So if somebody knows anything about CPR, the first things you do, the ABCs, is establish airway. You do a head tilt, chin lift to open up the airway so you can breathe in to give them respirations. The appliances we have, that's all it's based on. It snaps on the top teeth and the bottom teeth, but it pulls the bottom jaw forward, and not tremendous amount, but it pulls it forward, so when it comes forward, the tongue comes forward, and your airway opens up, and you're able to breathe on your own. And it alleviates your snoring and your sleep apnea. The people we put on it, they love it. They're so happy to get off a CPAP machine and a mask that's, blowing air down their throat all night long, and they can't roll over and have all the problems with it.
Wow. Does insurance cover them?
We're having a hard time with that. Yeah. So they want to pay for the CPAP, and if you can show us more research, come in and present it to the insurance companies. Blue Cross is real big in our state. They'll consider it. We are now talking to more sleep clinics and getting them to refer to us, and we're seeing better results because of that.
Okay. quick question on the amalgam removals. You talked about how much it would be with insurance. How about without insurance?
Depends on the region of the country. I happen to live in an area that you have the cheapest prices available.
Oh, really?
But, you know, you go to the West Coast and you go to the Northeast, you're going to be looking at the most expensive prices.
Okay.
They can range anywhere. A composite filling, I would say, will range anywhere from $100 to $500, depending on the dentist and where you live.
Got it. Okay. Someone's asking a question about bacteria. She says, since bacteria are such a major negative factor in the mouth, have you read or researched the correlation between the bacteria in the intestinal tract and the bacteria in the mouth? And what I have learned in the recent years, I personally feel that the right ratio of friendly to unfriendly is 85% to 15% in the gut. Is there a correlation with the mouth? Is there a relationship there?
Uh,
Are there any good bacteria in the mouth, for instance?
Yeah, and there is. There is. It would be hard to say a true correlation. Most of the issues that we see is the bacteria that's adhering to the calculus, and that's a visible product that you can see. Now, as the previous slide, you can see it on the teeth itself. So that's the main problem we have. Is there bacteria that's sitting in the pockets around the teeth that's invisible? Yes, there is. Could I give a true percentage relation-wise? No, I could not. But when it comes to most issues with periodontal disease, it is the bacteria that is adhering to that calculus. That if we remove it, you're going to remove, I would say, 90% of all the quote-unquote bad bacteria in the mouth.
Okay. Someone says she went to lvilive.com, but it does not allow you to click on Find LVI Dentist. Any other suggestions?
I might give them a call. There should be a phone number there, and ask them that. They've gotten a little finicky lately. If you're not going out there and taking their courses still, they have a tendency to sometimes bump you from their referral lists. But I know that we still get referrals from them, so you might want to call their 1-800 number and just talk to them personally and tell them where you live, and they should be able to give you a dentist in the area.
Great.
Dr. Luna, here's an interesting one. Is there any danger to you, the dentist, or the assistants long-term, removing all of those amalgam fillings? I mean, are there vapors that come off of the mercury or anything that is harmful to you?
Potentially, yes. There are some dentists that are extreme and have put in all sorts of ventilation systems in the room, wearing all sorts of masks. There was a dentist probably 20 years ago that he lost his license for doing that. And again, that was the ADA trying to prevent him from saying what he believed about mercury fillings. I go and get checked out by physicians. I have all my metal levels checked, typically once a year, to make sure I'm doing okay. Of course, we're doing everything we can from a patient standpoint. The only thing the patient's getting we're not having is the oxygen. But of course, we have our mask, and we're doing everything we can to quote-unquote suck up any vapors or pieces as they're being removed. My levels, I've never had any treatment. My levels are very low, so I feel comfortable with the protocol we use is taking care of everything.
That's good. That's good. Is gold any better?
Gold's a good product. It's been around. It does not contain mercury. There's some debate. Yeah, gold will last a very long time. There's some debate that all ceramic restorations are actually a little bit better because they truly chemically bond to the tooth. But I think gold's a fine product.
Okay. Folks, if you look in your chat box, we're sending you some notes and some information. Like some of our guests have actually sent us some websites that they feel could be helpful. So we're sending that chat out to you, and you can check them out yourself. Okay. Someone asked, how can I contact Dr. Luna?
Of course I didn't put it on here, did I? I have a website. It's www.diamondsmiles.com. So it's plural, and on there should have all our contact information, address, everything else. Our phone number is 205-988-9700. I have a 1-800 number, but I truthfully don't remember it. And email you can send to would be information@diamondsmiles.com.
Okay, thank you.
Great, thank you.
Somebody asked, as a result of deep amalgam fillings, I have several root canals. How safe are root canals?
There's some debate about root canals and some of the chemicals that were used for them, and it wasn't the root canal material itself, which comes from a rubber tree, rubber plant. It's an inert material, meaning the body doesn't react to it. But the sealers or the cements that were used in root canal, there was a product not that long ago that if it was pushed out of the root tip could cause nerve damage and permanent numbness. That product's no longer on the market. And so at this point in time, the sealers and the root canal material itself are all, as far as we know, safe.
Okay. I have had composites in my mouth that had to be replaced twice. And with the controversies regarding fluoride, I'm wondering what composites you recommend, as I know they are not all the same.
I would probably have to disagree with that comment in the sense that most of the composites out there now have all gotten to about the same strength and the same properties. If you're having problems with the composites, then I hate saying I'd be more worried about the technique that they were being put in. There could have been moisture underneath it. It wasn't a dry environment, so they were leaking from the very beginning or had bacteria underneath it. If it wasn't bonded properly into place, that would be an issue. A composite itself should not break a tooth ever. It should not leak if it's done right. Over time, it can wear some. The nice advantage to it, if it starts to wear down, you can, without removing the whole thing, just add back to it and repair that small little area.
Great.
So I'd be more concerned that there was something going on with the way that the composite was being placed.
Got it. Got it. So it's a technique. Speaking about bacteria, folks, and here, let me put another plug. There is a technology that involves they call it nano silver, not colloidal silver, but a special kind of nano silver. It's processed in a different way that has been found to be an FDA approved. It's found to be extremely effective against all kinds of bacteria, all kinds of harmful bacteria. That is, they seem to be selective. They attack the bad bacteria and they preserve the good bacteria throughout your body and in your system, and scientific research proves that. So, and again, that's on the website. It's called Winning the Fight Against Bugs with Nano Silver Technology, and I think then it's also take advantage of this technology as well. All right, someone's asking about can I view the rubber dam slide, please? Where can I find such an equipment and the rest of the equipment?
I wish I had pictures of that too. I don't know if we Googled it, if you would see a picture of it. It's basically a 6-inch by 6-inch just rubber sheet, and the dentist punches holes through it and has a little clamp that will wrap that sheet around the tooth itself. It does cover the entire mouth, but not the nose, so that you can breathe. Every dentist should have some. I mean, they were all taught in dental school to use the product. Most dentists don't use it, but they have it in their drawer somewhere.
Okay. Are there any health concerns with implants or root canals?
Implants are mainly a titanium post. At this point in time, they're showing truly no reactions to that metal with the rest of the body. The success rates with implants over the last 40 years has basically been about 96 to 99%. The failures usually occur with somebody who smokes or has severe illnesses such as diabetes, and also depends on the area of the mouth where they're put. So there's some areas where the bone is stronger and can support an implant better than others. Implants from that standpoint, I have not seen one documentation case or anything that says anything that's wrong with an implant. From a root canal standpoint, there was some issues with some of the cements that were used in root canals previously that caused nerve damage and numbness. It's been removed from the product, or from the market, excuse me, and at this time I don't know of any product that there's any issues with. The root canal material itself, again, is a rubberized material from a rubber tree and is an inert material that the body just doesn't react to.
Mm-hmm.
Dr. Luna, there's a question here about wondering if there's a natural substance that strengthens tooth enamel, such as stevia, but this person says, but stevia has been shown to also reduce testosterone levels. But I guess the main question is there a natural substance that helps to strengthen tooth enamel?
Yeah, at this point in time, I don't know of one. Again, one of my problems is, I have my practice, I see my patients, and so I go home to see my kids and don't do probably as much research as I should now, to be honest. There's so many new products coming out nowadays, it's hard to keep up with. One of the originals was a tooth and gum tonic. It was the first that came out and is still highly recommended by dentists. That's probably been out for about, it could be longer than I know, but I'd say it's easily been out for 20 years now.
And again, I guess it's probably, again, back to more nutritional things. A couple of questions were about vitamin C, if it helps is it advisable to supplement with vitamin C if you haven't taken your fillings out, and does vitamin C help reduce mercury in your body?
Yeah, from my standpoint, I would be leery for me to say that. You're starting to get out of my realm a little bit, and probably better question to Dr. Day from that standpoint. I think that the vitamin C, when we remove fillings, is shown to bind to the mercury that is just released into the blood system and helps to excrete it. So at that point in time, I like a high dose of vitamin C given. Other than that, I'm leery to say that higher doses of vitamin C are great to keep on for a long period of time.
Right. Yeah, I would rather suggest that people do the other modes of removal of heavy metals than use vitamin C as a mode to remove heavy metals from the body. I would tend to agree with Dr. Moon on that as well.
Have you heard of a product called tooth soap? Somebody typed in recommending toothsoap.com. Supposedly they have an excellent product when brushing teeth. It helps to, they have a remineralizing product. It's all natural. Have you heard of that?
Yeah, I have, and it's kind of like the tooth and gum tonic. There's a ton of new products coming out like that are trying to get away from the fluoride that's in the toothpaste. And as I previously mentioned, I think we're going to see that shift continue now, and see more and more ADA-approved toothpaste, at least, such as the Colgates and the Sensodynes and all that, go that way also, to where they're going to try to get less fluoride in there and go to different products that help remineralize the tooth.
Well, Doc, we're going to wind down now, but I just want to get this question out of the way because I think she's been waiting to have this answered. I had an abscess and had ozone injections a few years ago. Then later, the abscess kept coming back. I used therapeutic essential oils, which were effective in getting rid of the abscesses, but eventually the tooth broke off. The tooth happens to be a wisdom tooth, and now the whole tooth is broken with just a few edges sticking out. I did notice some more infection next to it, unfortunately. That part of the gum has a bridge. My question is, should I have done a root canal, or what else could I do now?
If the tooth is broken off at the gum line, as it sounds like it is, there's not going to be a very good long-term solution to restore that tooth. also being a wisdom tooth, it's very difficult to keep wisdom teeth clean. Our jawbone pretty much prevents the toothbrush from getting all the way back there. And that's why most dentists recommend having them removed. Without looking, of course, the way it sounds, I would probably be recommending removing the wisdom tooth to make sure that it doesn't have an infection that's jumping over to the tooth supporting that bridge, and then you end up losing the bridge.
Right.
That leads, before we finish up, I do want to say one thing. When it comes to silver filling removals and amalgam removals, there are some dentists out there that talk about something called cavitations. And what cavitations basically is saying when you had a tooth pulled, your wisdom tooth pulled years ago, there was tissue that was left in the jawbone. And that tissue is causing all sorts of infections and health issues, and that they need to do cavitations. Cavitations is basically where they're going to go back in there, without being gross here, cut the gums, cut the bone to get to this so-called pocket of tissue, clean it out, and then let it heal again. From my standpoint, there is no way that can be true. There's no possibility of it happening. First, the way wounds heal, when you pull a tooth and there's a hole in the jawbone, the tissue doesn't jump that gap and then everything heals underneath it. The tissue goes down the socket where the tooth was and then grows up. Just like any cut on your arm, you get a scab and the tissue grows under that scab and then pushes the scab up. And that's how wounds naturally heal. It's the same in the mouth. And so these dentists that are trying to say cavitations are necessary, they're just going back into a jawbone, in my opinion, opening another hole up, causing trauma, and closing the hole up. That's doing the same thing as when the tooth was pulled. So how could that be a treatment modality? And I had a patient here this past week. I talked to a dentist in California that said he had to fly out there, was going to be in a hospital for a week and do these cavitations and blah, blah, blah. There's dentists out there that are trying to take full advantage of this mercury scare and are doing things that are more damaging than good. So from my standpoint, cavitations is not a real procedure and something I would not do.
Okay. I have one last question I'd like to ask. I know there are several products on the market for brushing your teeth and oral care. Do you have a recommendation as far as electric toothbrushes, water picks, all of those kinds of things?
Sure. Rotary toothbrushes are now becoming standard and are shown to work better than a manual toothbrush. Oral-B has a good rotary toothbrush, and then Sonicare has the ultrasonic technology with it. The key to these toothbrushes is to use them properly. If you use a rotary toothbrush but go back and forth real fast, the rotation action never has a chance to really contact the tooth. Same with the Sonicare. You have to go really slow and let the brush do the work for you. So you're going to go around each individual tooth so that those toothbrushes get to do what they need to do. From a mouthwash standpoint, Listerine has always been somewhat the standard, but it's always had a lot of alcohol in it. And Crest came out with a Pro Health mouth rinse, and Discus Dental is a company that has come out with a mouthwash that you could only get in the dental office before, and they are now marketing it in mainly drugstores. That's a great product, and of course right now I'm drawing a blank on the name of it. There's also, from a water pick standpoint, a water pick is nice. Along with a toothbrush, it's shown scientifically to help keep teeth cleaner. There is a water pick called a Hydrofloss, Hydrofloss. It actually demagnetizes the water. It does something to the water that makes it more difficult for plaque to adhere to a tooth. So it's better than any other water pick, but a water pick is better than no water pick at all.
Okay, thank you.
Sure.
Great. Well, Doc, I think you have more than earned your next presentation here.
Well, good.
Thank you so much. This has been great. There's lots of great information that has been shared on this webinar, and we are really looking forward to many more, hopefully, that you would help to do for us. And people are saying thank you so much as well. So we appreciate you, and we might still, some people are still, obviously, I know this is going to come. So if you're not open to it, I will understand. But people are going to still email us with more questions, and I know you're very, very busy. If you can take care of some of them, that will be fine. If not, we understand completely as well.
Yeah, I mean, I understand, whatever you want to do is fine with me. If we don't get to everything tonight, some of them email me, on that information at diamondsmiles.com. That's fine also. It might take me a couple of days, of course, to respond to all of them.
Mm-hmm.
But, I check those every day. And so I have one of my goals is just to open everybody's eyes and see what we can do. And so I'm always willing to answer questions that people have.
We appreciate that, and lots of people typing in thank yous to express their appreciation as well.
Well, I just appreciate the opportunity to speak and talk again about something that I feel very passionate about.
Absolutely. Well, Sherry, anything else?
I don't think so, except during the webinar, and I was paying attention because I can multitask. I did get Dr. Koenig's things all in the store, so if you were interested in that, everything's on our website.
Okay, and next week, Tuesday, we'll be having the talk on healthy coffee. You need to be on it.
Yeah.
If you drink coffee.
I wish we could give everybody a sample and they could all drink some while we had the webinar.
I know. It's really good stuff. Great taste, too. It's
It is.
a little different from your regular coffee, but I tell you, it makes all the difference, health benefits-wise. I mean,
the whole world could have Gano breath.
Gano breath. Sherry.
Oh.
All right. Okay. Well, good night, everyone. Dr. Luna, again, thank you. Good night, and we'll see you all next week.
Good night.